Hi, my name is Dr. John Douillard. I want to talk to you today about a condition called SIBO, small intestinal bacterial overgrowth and candida, where bacteria that should live in the large intestine find their way migrating into the small intestine. And when that happens, digestive enzymes that are involved in digesting sugars and hard to digest proteins, these enzymes are altered by the wrong bacteria in the small intestine. The vast majority of the bacteria live in the large intestine. Only a select few bacteria should actually migrate or stay in the small intestine. And when this happens, we can get a host of digestive disorders, food intolerances, gas, bloating, pain, and many, many other conditions that I write about in the article associated with this video. And in fact, I've written a series of articles talking about how to resolve some of the underlying causative factors here related to this bacterial overgrowth issues. And I wrote one article talking about the major 5 causes, and I want to talk about each of those. One is poor hydrochloric acid or lack of good digestive fire is one. Number 2 is a history of chronic elimination issues, chronic constipation, chronic loose or stools, irritated and inflamed intestinal skin. Number 3, processed foods and sugar in the diet, something that we've all as Americans been fed for the last 30 to 40 to 50 years, and that has created some serious problems with the proliferation of the right bugs in the right spot for optimal digestion. And then medications. We have taken way too many medications that have a disastrous effect on the intestinal skin and the quality of your good microbiology. And then the last one is stress. Now I'm going to tackle one of these at a time in each of the articles related to these 5 imbalances related to bowel or bacterial overgrowth. And stress is an important one. When we're under a lot of stress, according to Ayurveda, we have one sort of energy in the body, a prana, a life force that goes down for reproduction, elimination, and waste removal. We have another energy that goes up into the head to give you energy and vitality and clarity. Well, if you're overwhelmed with stress, there's only one arrow or prana source here and one here. So the one that goes down for supporting energy, elimination, and adrenal function, it goes north to give you energy here, and it can leave this depleted. This in Ayurveda is called upward moving vata, or upward moving energy. And with that upward moving energy to cope and deal with stress comes the bacteria from the large intestine into the small intestine, specifically through a valve that separates the large and small intestine called the ileocecal valve. And that ileocecal valve can get damaged and problematic. And one of the major causes of bowel intestinal bacterial overgrowth is when the ileocecal valve starts to malfunction. And I want to give you some strategies to bring that back into balance as our first step to resolving these issues. And one of the techniques is the right type of probiotics. Chlorophyll is a precursor to good growth intestinal skin. Very, very effective. Chlorophyll-rich foods and chlorophyll as a supplement can be very effective for healing and repairing and the function of the ileocecal valve. Probiotics like lactobacillus, bifidobacteria longum, and Saccharomyces yeast have all been shown in science to support the health of the right bacteria in the right places of the health and function of the ileocecal valve. There is also an exercise, a massage technique that I want to teach you today of how to actually massage your ileocecal valve. And when you think about that valve, it's like a zipper. It can be opened or closed. If the zipper is down, it is open. And that means bacteria can go from your large intestine into your small intestine and create real problems. If it's closed, zipped up, then that means that you're having issues moving food, things, toxins, food from the small intestine into the large intestine. If the zipper is closed, the valve is closed, you can get things like constipation, holding on to more food, gas, bloating, abdominal pain, tension, because you're not moving things through the way you should. If the valve is sort of stuck open, it can actually cause undigested food to move through, looser stools, and problems with, of course, the bacterial overgrowth bacteria moving from the large intestine into the small intestine. So the exercise and the technique and the massage, I take you step by step in the article, so go to that as well, is very, very simple. The first step is locating the ileocecal valve. And if you find your navel right about here, and you find your hip bone right about here, and you draw a line from the front of your hip bone to here, and you go right in the middle, that is the ileocecal valve area. Okay, and the first step is to see how it feels in there. So you go in there and you put a little pressure, gentle but firm pressure, and you feel around and see if you feel any tender areas there. Okay, this is also the area of your appendix, which is close by. So that could be, something you have to be watchful for as well. But usually when that becomes a problem, it's very, very tender. This is sort of a hard, kind of a tender feeling that you feel in there. Sometimes it feels like a golf ball or a hard, tender area nodule that's in there. And if you feel that nodule, we want to massage that tension out of that area. And the valve is a circular sphincter-like muscle that opens and closes. So what we're going to do is we're going to use some circular pressure. And if the valve is actually stuck open, which means the zipper is down, we want to zip it up. So we want to, as we're doing circular motions, a clockwise motion, then that valve is stuck open, and we want to close it. We're going to pull up on the abdomen and then down and up and exaggerate like an oval pulling up in that area. And you do this for about 2 minutes in a circular motion, emphasizing the upward pulling, closing the zipper motion, and this closes the valve, generally for bacterial overgrowth. If the valve is stuck closed and the zipper is up, we want to go in a counterclockwise direction with the emphasis pushing down and pressing the tissue down towards the pelvis. And you do that for about 2 minutes twice a day and for at least 30 seconds to a minute before each meal. If you're thinking that you have bacterial overgrowth, always think the valve is open and you're going to be pulling up. Details are written in the article associated with this video. In addition, I'm a big fan of those vibrating massagers where you can actually get in there and vibrate that tissue, because sometimes massaging that hard nodule, it's a little hard with your fingers, maybe not strong enough, and a vibrator can go in there and do it. A full abdominal visceral massage is also great for that tissue in there to get things right, because massage means circulation. Circulation means better function for all the tissues involved. But a massager right in that area. And once you get it massaged and sort of soft, then you can go in there and do your circular motions to either sort of open or close your valve. Remember, it's like a zipper. If it's zipped down, it's open. If it's zipped up, it's closed. Follow the article read the article in the video, in the article associated with this video, and play with that. There will be future articles talking about the other 4 most common reasons why the bacteria migrates from your large intestine to your small intestine and causes some pretty significant digestive imbalances. Thanks for listening. I'm Dr. John Douillard. Hi, did you like this video? Do you like our content here at LifeSpa? You can subscribe to our YouTube channel at youtube.com/John Douillard right here and get this valuable content every week in your inbox.
This recording is brought to you by LifeSpa, where ancient Ayurvedic wisdom meets modern science. Get access to free health video newsletters by Dr. John at lifespa.com. These statements have not been evaluated by the FDA. These products are not intended to diagnose, treat, cure, or prevent any disease.